Hey everyone, welcome to the video version of the Reviving Vet Med podcast. Today we're talking about stress management and career fulfillment in veterinary medicine. We'll explore how veterinary professionals can handle high workloads, manage stress, and build a career that feels meaningful and sustainable. My guest today is Dr. Amy Grimm, a veterinarian, certified success and well-being coach, and founder of Burnout-Free Me. Amy helps high responsibility professionals, including veterinarians, break free from hustle culture, regulate their nervous systems, and create success without sacrificing their health, relationships, or sense of self. In today's episode, Dr. Amy and I dive into her personal journey through burnout, practical strategies for managing stress, mindset shifts that support long-term fulfillment, and the role of life outside of the clinic in sustaining well-being. We also cover actionable steps you can start using today to feel more balanced and energized in your career. So let's get started. Here's my conversation with Dr. Amy Grimm. All right. Thanks so much for being here, Amy. Welcome to the podcast. It's great to have you.
Thank you so much, Marie. I am delighted to be here.
I am going to jump right into it and dig into your journey. I know that you've experienced burnout and then you transitioned into coaching. And I'm wondering what the pivotal
Mhm.
moments were that helped you shift from that state of exhaustion to a more sustainable, fulfilling career.
Yeah, that is such a great question. Thank you. And I really like talking about this because when I look back on my journey with burnout, there wasn't really this like big breaking point for me. It was more like this quiet reckoning. And I think that's because I ignored so many signals for so long. So these pivotal moments that I had, they weren't really epiphanies. They were kind of like just these quiet shifts. And I think what many people can identify with is that for a long time, I just told myself that the exhaustion I was feeling was simply part of the job. Veterinary medicine is demanding, leadership is demanding, being capable and responsible and ambitious is demanding. And I just normalized that. I normalized the fatigue and I assumed that I was tired because I was working really hard, which, yes, that's true. And I eventually had to admit to myself that this level of exhaustion is just not sustainable. And that sounds really obvious, right? Like, duh, and super simple. And it was also kind of unsettling because to me, this had always just been how it is. That's just what vet med was. And I really had to admit to myself, okay, if I continue doing it this way, then sure, I might have a successful career and one that looks good on paper, but at what cost? Am I actually enjoying it? And am I going to lose my ability to enjoy my life? And that realization was really pivotal for me because I had to acknowledge that yes, I love my profession, and that doesn't mean that I need to accept this kind of chronic depletion as the price of admission. And that's when all these other little shifts started coming into play. And I think another really simple but big one for me was just noticing the kind of language I was using with myself because I would constantly tell myself, I don't have time to rest. I don't have time to take a break. There's too much to do. There's too little time. And I really wasn't allowing myself to slow down because I thought it would fall behind. And I realized, that those moments where I was telling myself that I just didn't have time, those were actually the exact moments that I really needed to pause and to get curious and to take a look at what was going on in my internal world. So I began practicing, noticing one, when I'm telling myself that story, two, pausing when I feel that overwhelm or stretched really thin and really asking myself, okay, what do I need right now? And my brain would yell a bunch of answers about, oh, I need to get this record done and I need to call that client back and I don't have time for a break. And I had to say, okay, brain, and like, what do I as a human actually need right now? And sometimes the answers were really surprising and basic. They were things like, I think I need to get up from my desk and stretch my body and move, or maybe I just need to step outside. For me, that's a really big one, being able to step outside the building. And sometimes, if I'm not able to do that, I'll even try and stick my head out a window. It's like just getting that natural sunlight. And other times it was just like, oh, girl, you're hungry, you're thirsty, you really need to pee. And these things, they're not profound, they're just basic human needs. And yet, they're often the things that we just override in the name of productivity. And when we repeatedly ignore those signals, that's when we keep our nervous system in this heightened state of stress. And that's really what depletes us over time. And we start going through the motions, which is exactly what I was doing, instead of moving through the day with intention. And I'll be honest, these small little pauses and intentional shifts, they did not fix everything overnight. Not at all. But what was really foundational for me is they began to shift my relationship with myself. And I stopped treating my body like it was this inconvenience. And I think that really hit hard for me, and I started listening to it for information instead. And that's what helped me start reconnecting with my values and asking myself, okay, what do I actually want my life to look like and feel like? Not just like look impressive on paper or what's expected of a vet, but what actually feels aligned and meaningful and just that really deep sense of satisfaction and connection. And I wanted to enjoy the success and have this meaningful and sustainable career in addition to having room for joy and to be present in my relationships and to create this sense of wholeness outside of work. And all of those tiny little steps and shifts and reflections, they really help me redesign how I practice veterinary medicine. I still love it and I still do it, but it's different now. And I am intentional about my energy and my boundaries and the roles that I accept. And I don't equate self-sacrifice with commitment anymore, which was a story that I had bought into for so long. And then, as you mentioned, I added coaching because I really discovered how fulfilling this was to support other veterinarians and now other high achieving, high responsibility professionals who are quietly struggling the way I once was. And I really care about helping women build careers that don't require them to abandon themselves. And I really want to help create a kind of culture where burnout is not normalized as proof of dedication. So, this shift out of burnout for me had a lot to do with just becoming more honest with myself, more aligned, more responsive to my own nervous system, and understanding that I can have sustainable ambition and that actually requires care from me, not just this constant override that I'd been doing before. And I think that understanding, that's what really just changed the trajectory of my career. And it's changed how I move through life entirely.
I love that. I mean, you bring up so many important points. I definitely want to reinforce this notion that burnout has almost become normal. Like the pathology of burnout has become normalized in vet medicine. You hear students and new graduates all the time saying, well, everybody burns out. Eventually I'm going to burn out. Like they're anticipating it as if it's normal and okay and that there's nothing that one can do about it, which you and I both know is very harmful. And it's so interesting. I had a parallel experience with you in that I too was experiencing these symptoms of stress and exhaustion, and it was wreaking havoc on my mind and my body. And I looked around at other people, and it just seemed like everybody had it figured out. Everybody was doing okay. Everybody was continuing to work. And like you, rather than really listening to my body and the signs that it was giving me. Every time I would go to a medical practitioner with another ailment, they would say, "Gosh, do you think maybe this has to do with work and that you need to slow down?" And I was like, "No, everybody else is working hard, and this must be due to something else." So I love that you really had to reframe what your body was telling you. And as you said, override what the mind wanted to do, which was to push through and persevere and continue on and accept that this is just what we do in vet medicine. And I'm wondering, with your experience in coaching professionals, all high achieving professionals, what do you see are those early signs of burnout that we tend to miss? And you've talked about this almost like a mind body connection and this intentionality of tuning in. Talk us through what that would look like for any professional, whether you're in veterinary medicine or not.
Yeah, yeah, that's it. It's such an important question, Marie, because I think, when I think about what people think about when they think about burnout, I often think, of that deep disconnection, disengagement, the cynicism, just the going through the motions, ready to quit, exhausted. And that's a much later stage. Burnout, it exists along a continuum. And I think, especially for me, coming from a nervous system perspective and a coaching background, is I don't only think of burnout as being an occupational hazard. I see burnout as a nervous system response, a predictable response. And because of that, I see so much more when I'm talking about the experience of burnout in general. And these early signs, they can really be kind of quiet or, a little bit trickier to notice once again, because we have these stories about, how this is normal or it's just the way it is. So, in many of the professionals that I'm coaching, and especially veterinarians, there's often this chronic shift to what I call, chronic activation, where maybe you feel slightly on edge for no apparent reason. You can't quite put your finger on it. And you notice that your patience is maybe getting a little shorter. You can also do things like replaying conversations in your head or over-analyzing and second-guessing decisions that you've made. And maybe you just have trouble switching your mind off, like there's always something for you to think about. And all of these things, they become kind of normalized, and we think that this is just the experience of our high responsibility or high pressure roles. And there's this pattern where, we continually override ourselves because we think that it's so normal. And then we start seeing changes in behavior, like always working through lunch, holding your bladder through multiple appointments, which I have definitely been guilty of, and showing up sick when you really need to take that time for yourself, but you're telling yourself that, your team really needs you. You say yes to extra responsibilities when you don't really have the capacity for that. Or maybe you agree to things that you don't really want to do and then you feel resentful later. And none of these behaviors automatically mean that you are burned out or that you're definitely going to become burned out. I think the big problem is when we don't see them as warning signs and we instead look at them as proof that we're being committed. And like you mentioned earlier, we see our colleagues doing the same thing, and we see our mentors and our bosses model modeling this self-sacrifice, and we internalize these messages that this is what a good veterinarian does. This is what high-level leadership looks like. And these small little acts of self-neglect, they just accumulate. And the thing about your nervous system is that it cannot really distinguish between a true life and death emergency and a pattern of just chronic self-neglect and override, which is equally activating to it. So it just learns that output needs to be prioritized over your own safety. And that's how we end up running on fumes. And I think the biggest piece of advice I could give for someone who wants to be proactive about preventing burnout or even starting to recover from it is really awareness. You spoke a little bit about the mind-body connection, and that's exactly what we need to build awareness around. So if you notice that your brain is constantly telling you to override basic needs, that's information. And if you're saying yes to an extra case or emergency or staying late and feeling resentful about it, that's information too. And if your mind just never quietens down, that's also really useful feedback. So, really becoming aware of what's going on in your brain and then also feeling what's happening in your body. How do you feel in those moments? And not just emotionally feel, but the sensations that you feel, like tightness in your chest, any tension, maybe you just have this overall feeling of unease. That's really where we start to connect the brain and the body together. And if you are somebody who's starting to become aware of these things, one practical step that you can do is to start establishing like non-negotiable anchors in your day. So things like eating lunch. If you notice you're someone who constantly works through lunch or skips it, that would be a great anchor for you to put in place. For me, using the bathroom when I need to instead of holding it for 5 appointments and dancing around in the room. And another one would be, stepping outside. Like that really works well for me too. And none of these things are luxuries, and they're not inconveniences either, even though our brain might try to tell us that they are. Like these are regulatory inputs for your nervous system. And when you protect them, you're protecting your cognitive clarity and your emotional steadiness. So, really learning about your entire nervous system is so, so powerful because when you start to understand your stress response, you can catch it earlier. You can notice that tight chest, the shallow breathing, any mental urgency that you have. And instead of trying to push through and work harder, you can take a step back and you can intervene. You can slow your breathing, maybe do a grounding exercise, a little body scan to bring yourself into the present moment. And these tools, they're really small and they're simple and they interrupt that escalation cycle of the chronic stress. So those are really the foundations that I think about. And then, you can start adding in things like setting boundaries. And if you're not someone who's comfortable doing boundary setting, then boundary rehearsal, practice with somebody. Many of us intellectually understand that we need better boundaries, but we don't have any practice setting them or saying no. So, working with a coach or a mentor or even somebody who you trust to just help give you that language and then really tying it into your why. Once again, when you tie it into a strong reason, your why, you're again connecting your brain to your body and to your entire experience. So, for example, one of my whys is, I am not going to take this additional case because I know that protecting my energy right now will allow me to provide better patient care to the patients that I am already caring for. And that's really something that helps anchor me in that moment. And it feels less selfish to say no. And I feel like I'm living more into my integrity. And then another proactive step that I like and I really encourage people to do is, just do a quick energy audit once a week or once a day. Check in with yourself and say, okay, what drained me today? And what gave me energy? And just be curious. And I especially recommend that people write it down because you can start to pick up on your patterns a lot quicker. And that's when you can start looking at your life and maybe adjusting your schedule or other commitments that you have, or even adjusting your expectations of yourself before things like resentment and depletion set in. Because ultimately, veterinarians, veterinary professionals, we care deeply, we're deeply committed. Many of us are ambitious and we want to help. And preventing burnout, it's not about saying no to those things. It's really about becoming more attuned with yourself and knowing that you can excel in your career and prioritize your well-being. And the truth is, really, your long-term performance and excellence depends on it. So, yeah, those early signs, they're not very dramatic. Oftentimes, they just seem kind of normal. Many of us just disregard them and keep going. We override the signals. And that's when we end up, repeatedly choosing our output over our own humanity. So building awareness is what helps you interrupt that, notice those moments, and that's where you can start becoming more in control and feeling more empowered over the direction that your career is taking you.
So many great points, and I want to go back to what you said, just really focusing on the nervous system. And I think veterinary professionals can relate to this because we all took physiology, we all understand the sympathetic nervous system and that fight or flight response or freeze, when some of us shut down and numb out or whatever it is, versus our parasympathetic rest and digest. And you hear more people talking about things like adrenal fatigue, whereby they've just been in this adrenal squeeze of cortisol release and fight or flight for so long, and forgetting what it's like to pump the brake and to slow down and to rest and do all of those things that we need to do. Like the nervous system cannot be in a constant state of go without pausing. Otherwise, it's just going to exhaust itself, which is, like you said, the later stages of burnout. And so, what I'm hearing you say is that introducing even these small activities, such as getting fresh air, taking a deep breath, slowing your breathing down, all of these things that we can do that have scientific evidence behind them, that they actually do activate the parasympathetic nervous system. They slow things down, and how very important that is. And I think it's only when we slow down that we can actually really tune in to some of those sensations and feelings that we are experiencing. And then I love what you said about the non-negotiables and the boundaries. And for me, non-negotiables are simply a form of a boundary, right? It's I need this to get through my day. I need to be able to step off the floor when I'm working in the ER so that I can go to the bathroom, get some food, drink some water, take a break from the beeping machines and the phone calls ringing into the hospital or whatever it might be. And those, like you said, those are basic human needs. And we have programmed ourselves to think that as veterinary professionals or high performing professionals, that we don't need these things because we are these elite almost elite athletes working in this performance, like you said, this high stress, high performance job. But when you think about even the most successful athletes out there, they still need to rest. They still need to take breaks. They can't be at their highest performance all the time. I do believe that so much of this inability to slow down and this culture that we have of normalizing burnout in vet medicine comes from feeling this constant pressure to do more. And I know that you talk about this like hustle culture and this productivity mold, so to speak. How does a person break free from that and give themselves permission to slow down, to rest, to go to the bathroom, to do all these human functions without feeling guilty or like they're going to fall behind?
Yeah, yeah, that is the $1 million question. And I truly think that the first step in breaking free from this kind of hustle culture is just recognizing how human this pressure feels. Of course you want to do more. You care about your patients, you care about your clients, you care about your team. If you are a high responsibility professional, your desire to contribute is a reflection of your values. So instead of shaming that drive, I really encourage compassion first. Of course, it makes sense that I want to show up fully. Of course, it makes sense that I feel pulled to give more. I care deeply, and that is human. And you know what else is human? The need for rest and recovery, the need for joy. And somewhere along the way, many of us internalize this belief that taking care of ourselves is indulgent and that slowing down means we're going to fall behind. But if a close friend came to you and was exhausted and overwhelmed, you wouldn't just look at her and say, you know what, you need to push harder. You wouldn't tell her that she should feel guilty for needing a break. You would offer support. You would remind her that she matters too. And the question then becomes, can you extend that same compassion inward and be a friend to yourself? And I think this is one of those pivotal shifts that so many of us need to practice because it doesn't come as naturally. So that's one of the first places that I like to start is helping people extend that compassion inward to themselves. And that ties, your experience with your body and your brain. So once again, creating that connection. And when we're able to create that connection and create safety, that's when we can start getting inside the brain and looking around at what's going on there. And a really powerful shift that I really, really believe in is questioning the stories that our brain tells us about completion and what it means to get things done. Because so many of us, we live with this promise that we've given ourselves that, once the list is done, then I can relax. Once I've completed my callbacks, once I've completed these records, these prescription refills, whatever it is, then I'm going to allow myself to eat a snack or go to the bathroom or take a break. And we even do this with our weeks. We say, oh, I just have to make it to Friday, and then I'll be able to, insert the thing that I want to do. But the truth is, the list never ends. There's always going to be another case, another email, another callback, another responsibility. And if your permission to rest is tied to whatever your brain thinks completion is, then you're never going to feel like you're permitted to rest. And that kind of belief really creates a chronic internal pressure where it keeps our nervous system in the state of chronic activation, sympathetic activation. And it also reinforces the idea that your worth is tied to your output. But that's not true at all. You are a human being doing your best with the resources you have on any given day, and your best is going to look very different depending on your energy, your sleep, your emotional load, what is going on in your relationships, any illnesses, not to mention the resources available to you that day in the clinic, things like staffing, medications, maybe there's equipment issues. All of that can affect your day and your experience. And that doesn't mean that you're falling behind, that just is part of being human. So I think it's very important to become aware of that and to extend that compassion there as well. Of course, these things happen. This is a normal part of being a veterinary professional. And that allows you to take a step back and look at the bigger picture. And I think looking at the bigger picture is very important because we also need to learn how to reinterpret our relationship with urgency, reinterpret that signal of urgency. Because if your brain is telling you that you don't have time to slow down and there's too much to do and too little time, that's the moment that you have to recognize and pause and slow down, even if it's just a few seconds of intentional breathing, that can really help you interrupt that internal spiral. And no, it is not going to make you less productive. It's actually going to help you be more regulated and expand your capacity and even improve your decision making and focus. An analogy that I really like is if you think of professional drivers like NASCAR races or Formula One, they are high performance and they are going around the track. And at some point, they have to slow down and actually come to a complete stop. Whether it's to have something checked out under the hood or get the tires rotated or put more gas in the car, they have to stop. And while they're doing that, other drivers are continuing and they could be getting further ahead or they could be lapping them. And sure, you could decide, I'm going to be the driver who says, well, F it. I'm not going to make that pit stop. I'm just going to keep pushing and driving while these tires are going bold because I don't want to slow down and risk that somebody else might overtake me. And sure, you can do that, but then you're at much higher risk of catastrophic failure. What if you do, have a tire that explodes or something goes wrong with the engine, or maybe you just run out of petrol, and then you don't even finish the race. So you really have to create these intentional pauses to look after yourself and breaking free from this productivity trap. It's not about abandoning your ambition or your desire to help or, even how much you care. It's really about redefining what sustainability looks like to you. And rest and self-care are not rewards for finishing. Rest and self-care are strategies for your long-term performance. And I think this can be difficult because we've bought into this kind of story for so long. And if you are somebody who finds this particularly challenging, then find a mentor or a coach who can help you because so much of this pressure to constantly give more and do more is driven by unconscious beliefs about our worth and what success means, and also comparison to others. And working with someone who can help you surface those beliefs and examine them and then build a more compassionate internal dialogue can be so healing and transformative. And that's how you start reducing the guilt and improving your own clarity, aligning your experience, and really pursuing excellence without sacrificing yourself in the process. And really if you think about falling behind, you fall behind by not taking care of yourself. And when you do, you give yourself the capacity to keep going in a way that feels steady and aligned. And that is just such a different type of success.
Absolutely. And, it's interesting because I think a big piece of it is this guilt that we experience. I wholeheartedly stand behind this self-compassion because I think we do just push on and push forward, and we can be very hard on ourselves. And I think, especially those who identify as female, there's this pressure to just be doing the best at everything, whether you're being a parent or a partner or a high performing professional or whatever it might be. And we feel guilty all the time that we're letting somebody down or we're not doing enough. Or if we're doing really well at work, then maybe we're not doing so well in our personal lives. And people ask all the time, well, how do I alleviate this guilt that I experience when I say no to a shift, when I take a break at work or whatever it might be? And I think that the self-compassion can absolutely help. And I think it also goes back to something that you mentioned earlier in our conversation, which is digging into that why. I truly don't know that the guilt ever really goes away for those of us who really, really care, and that's pretty much everybody in this profession. But if we can go back to why I need a break, why if I don't stop to go to the bathroom and say no to this extra commitment or whatever it might be, I know that I need to do that because if I don't, my wheels will literally fall off. And I know for me, my biggest why when I'm feeling guilty has always been because I want to show up in all parts of my life as the best version of myself. And I cannot do that if I am not getting enough sleep, if I am not getting outside, if I am not moving my body, if I'm not eating healthfully, if I'm not connecting with a mental health professional routinely, all of these different things that in some ways are non-negotiables, in some ways are habits I've established, but I hold tightly to those, even though those often prevent me from helping and taking on other things, because I know if I don't, then I will show up to those other things resentful, tired, angry, frustrated, etc. And I think this ties in a little bit to something else that you talk a lot about, which is mindset traps. We can get stuck in these burnout cycles because of these particular thinking patterns that we have. How how do you help people engage in practical steps to shift towards more healthier approaches to their work?
Yes, yeah. Mindset is a big component. And really, one of the biggest traps or misconceptions that I see is this belief that every thought we have must be true. And it is true. When in reality, our brains, they just generate interpretations constantly. They like to predict and evaluate and scan for problems. And that's what they're designed to do, right? They're trying to protect us for survival. And it can become problematic when we treat all of those interpretations, every thought in our head, as a fact. So, an example at the clinic could be that, you get there in the morning and your lead technician calls in and says, you know what, I am super sick and I cannot come in today. And the thought that pops into your head is, well, this day is going to be terrible. Yeah, that feels true in the moment. It might even feel obvious, and it is not a fact. That is just your brain making a prediction. And the moment you believe it without questioning it, that's when your nervous system begins preparing to have a bad day. You can already feel yourself tightening up, bracing, And you can even interpret just neutral events throughout the day through a much more negative lens. So, a very practical step when you notice these types of thoughts is to just pause and question it. Not in a way that you're dismissing like dismissing reality. You're not trying to be overly positive and pretend that, yay, everything is going to be fine, but you're just trying to introduce some flexibility and open the door to the possibility that maybe it could be different. It doesn't have to be terrible. And you could say to yourself, okay, brain, sure, that's one possibility. And yes, it is true that today will look different, but it doesn't automatically mean it's going to be bad. And maybe, just maybe we can get through this day making some adjustments, and maybe we can get through this day still, honoring ourselves and our boundaries and practicing good medicine. And maybe it's going to look different than it would have if the lead tech had shown up. But we can still find ways to take care of ourselves, our patients, our clients, our teams. And then you can start thinking about, okay, how do I actually want to show up? What's within my control here? And like I said, it's not about pretending everything is positive and it's going to be fine. Things happen. But it's really about recognizing that you do have influence over your own internal narrative. And if you just assume that the day is going to be awful, then you can unconsciously create that experience. But if you stay open to the possibility that it could be meaningful or it could even be good, that's when you start creating space for a different outcome. So I think that's probably the biggest mindset trap that I see. And then a very close runner up is this assumption that if you're struggling in some way, there must be something wrong with you. Many of us immediately jump to self-criticism, telling ourselves that we're not efficient enough or smart enough. I should be able to do it faster. Other veterinarians could handle this better. They seem to have it figured out. And again, these thoughts are not objective truths. So a more useful question would be asking yourself, okay, I am feeling a little behind, a little on edge, I'm struggling. What if I ask myself, am I resourced right now? Have I slept? Have I eaten? Have I taken a break? What else is going on in my emotional world? Am I carrying any emotional residue from a previous case? It's when we skip those questions and go straight to self-judgment, that's when we start pushing ourselves harder instead of actually offering ourselves support. And a healthier, more aligned approach to work really begins with noticing these types of stories that your brain is telling you and then gently rewriting them. We're not trying to be toxic positivity over here, but we are trying to be accurate and once again, compassionate. Pay attention to your body. Some days you're going to have more energy and more cognitive capacities, and some days you're not. And that variability is human. And I do want to say that if you are in a leadership role, this becomes even more important. Culture is shaped by what is modeled. So when you, as the leader, acknowledge your own limits and you respect the humanity of your team, it creates psychological safety. And it signals that, perfectionism is not the expectation and that we can allow productivity to fluctuate without placing any moral judgment of it. Burnout cycles, they're often fueled by unquestioned thoughts and relentless self-pressure. So when you learn to observe your own thinking instead of just automatically believing it, then you can adjust your expectations based on your real capacity, and you can create room for healthy sustainability. So, mindset work, it's not just about thinking happy thoughts, it's really about thinking intentional ones, choosing intentional ones that serve you.
I love that. I think what I hear you talking about really is noticing these cognitive distortions and engaging in more flexible thought patterns, right? And like cognitive reframes almost. And the two you really seem to highlight are this catastrophizing, right? If one team member doesn't show up, the whole day goes to goes in the garbage, right? Or the shoulds, right? I should be able to push through. I should be able to see 20 cases in a day. And I love that you really highlight the awareness around these and adjusting. And it can be the most slightest of adjustment. Like you said, we're not leaping into toxic positivity. Everything is amazing always, and we must always be happy. But looking at it in just a slightly different way. Is there a way that we can get through this, that we can band together and get through this day despite being short staffed? And like you highlighted earlier, given the resources that we have today, we are going to be moving through the shift a little bit differently, and that's okay. Let's be kind to ourselves in this moment. So I love that you highlighted those things. I want to ask you another question because I know that you really emphasize adventure and nature. You've talked about sticking your head outside the window or getting outside of the practice, movement, all of these things outside of work. How do you feel that integrating these meaningful activities outside the clinic helps to support stress recovery and a more healthy relationship with work?
Yeah, yeah. Thank you, Marie. I do talk a lot about nature and getting outside and moving because they remind me of something very simple and very, very important. And that is that I am a whole human being. My profession is just one part of my life. It's not the entirety of it. And when work begins to dominate your identity and your time, then your nervous system doesn't really get the memo that, hey, it's safe for us to shift out of this performance mode. So instead, you stay in your doctor brain, you stay in problem solving mode, you stay in responsibility mode. And even at home, your body can feel as if it's still on work or on call. So integrating these meaningful activities outside of the hospital interrupts that pattern. It allows you to access different parts of yourself. For me, that often looks like high intensity movement outdoors. My partner and I do a lot of hiking, biking, climbing, running, things like that. We love being in nature. And for me, there's something really regulating about this physical exertion paired with open space. And I love that feeling of expansion and just of awe, of being out in nature and in the wilderness. And it gives my stress somewhere to go. I can release it while I'm moving. And it also reconnects me to my joy and my curiosity. And it doesn't have to look the same for everyone. For other people, it could be creative expression, like singing, painting, cooking, gardening, playing an instrument. This is a very powerful way to help you process emotion and move energy through your body. And it's a different channel than you just constantly trying to think about it. So sometimes stress release, it can be very energetic and activating. And other times, it's slow and gentle, like going on a quiet walk, stretching, sitting by a river. Both are valid. And the key is to learn to notice what you need and also having multiple ways, multiple tools, hobbies to support yourself because there's the psychological shift that happens when you cultivate meaning outside of work. Because when your entire sense of purpose rests on your career, your days can start to feel heavier. So if you derive meaning from relationships and hobbies and exploration and community, that weight is distributed, and work no longer has to be perfect in order for you to feel good. So rest and recovery, they're really strategic. We often think that we have to earn it. We rest when the work is done. But in reality, that rest really fuels your performance. And rest doesn't just mean sitting on the couch or sleeping. Rest is any of these activities that allow your body to recover and that allow you to then return to work with more clarity and patience and resilience. And ultimately, that benefits you and your patients and your clients and your team. So, this whole integration, it's not about you trying to escape your career. It's about you expanding your experience as a human being. And when you regularly engage in activities that make you feel alive and created and connected, that's when you're supporting your nervous system and you're helping yourself complete these stress cycles. And you can remind yourself that you are more than just your job, you are more than just your productivity. And this is going to help you support your long-term career satisfaction because you're no longer asking your job to carry the entire weight of your fulfillment. You are creating that meaning and fulfillment and happiness for yourself in your entire lived experience.
What a beautiful place to end off. I want to finish by asking you just one last question that we ask all of our guests on the podcast, which is what does the phrase reviving veterinary medicine mean to you?
Uh, you know, when I hear that phrase, I have kind of two reactions. The first is curiosity as a coach, because embedded in that phrase is the assumption that something is broken or dying. And while there are certainly challenges in our profession, I am careful not to buy into the story that we are beyond repair or uniquely struggling, and that, burnout is just a consequence of the work that we do. And I do believe that, every generation of professionals faces different stressors, and what can feel different now is that we are becoming more aware. We talk more openly about burnout and mental health, and, we're bringing psychological safety and nervous system work into the workplace and the culture and the leadership. And sometimes that can make it feel like things are maybe a little worse, but I also like to hold the truth at the same time that this also means we are evolving. So for me, it's about, refining or helping to redirect the profession. And as a coach, it always comes back to understanding ourselves better. Understanding that we are human beings with nervous systems that respond predictably to stressors. And there's always going to be emergencies and things that activate us. And that can be useful when a critical case comes through the door and we need energy to help us focus and mobilize. But the problem is not the stress response, it's when we live in it chronically. So reviving vet med is building this culture where we know how to come back to ourselves, where we create that psychological safety, where there's room to rest and to process our emotions and to debrief after hard cases. It's where our leaders can model boundaries and humanity, and where high performance and well-being are not positioned as opposites. We're designing systems that support regulation instead of just rewarding constant overdrive. And we're teaching veterinarians and veterinary professionals that you can love this profession deeply and still protect yourself within it. If we resource ourselves well and we create environments that support us, we get to practice at a high level without sacrificing our health or our joy. And we can create these long, sustainable, meaningful, fulfilling careers. So essentially, we're building a profession where we thrive. And at the heart of it is that we are remembering that This work is about caring, and that care, it has to include us.
Well, I can't thank you enough for all of your incredible words of wisdom and all of the practical tips that you've shared with us today. Thank you so much, Amy. It was really wonderful to have you on the podcast.
Ah, thank you so much, Marie, and thank you for doing what you do. I love that you have a platform to help so many veterinary professionals, and I truly, truly appreciate you sharing your time with me today.